Gut IQ nutrition and wellness videos are meant to be informative and educational. They are not intended to diagnose, treat, prevent, or cure any disease or condition. It is not intended to substitute the advice, treatment, and/or diagnosis of a qualified licensed healthcare professional. Hello and welcome back. I hope you're having a wonderful day. Today, I want to share with you a little story about one of my many underlying conditions that I had going on whenever I was extremely sick and I started seeing my naturopath. All of these things started uncovering in my health. And it was just like one of those, that's why that's been hurting. And so it's just one of those things that as you get older and you start having little pains here and there, it's very easy to just dismiss these alarms that our bodies are giving us. And as a matter of fact, the medical system or the medical machine will help you do just that. I'll give you an example. Probably about, I think it was maybe a few months before I got extremely sick in 2021, I was having pain in my leg. And every time I would sit down to go to the toilet, sit on the toilet, or if I was sitting at my desk for a long time, I would notice that my varicose veins would start bulging out and start hurting like crazy. And I had a friend in high school, and her dad basically had a clot dislodge. He was, fairly active, pretty healthy in his 40s, and he had a clot dislodge in his leg after pain, and it went to his heart and killed him. And so whenever I started having this pain in my leg, I was like, oh no, what if it's a clot? Because it did feel like a clot. And whenever I Googled the symptoms, it said that it could be a clot. It was hurting extremely bad one day. And so was taken to the ER, and they took a look at it, and I believe they probably put me through the CT scanner. And ultimately they said, nope, you've just got varicose veins, and sometimes they hurt, but it's mainly just like a cosmetic thing, but you should follow up with your primary care doctor. So I followed up with my primary care doctor, and they told me, oh yeah, you could probably go get them lasered, but it's more cosmetic, there's not really anything to worry about. And so I didn't really worry about it. And then I started seeing my naturopath and told her about the varicose veins, and she was like, persistent about me going to see her vein specialist. She said some of them are very surgery happy, some of them not so much. I only want you to go to this doctor because this is the one that I trust. He was a little bit of a drive for me, but I was glad that I made the drive. I ended up going to a vein specialist in the Mid-Cities area of DFW. He was great. They basically sonogrammed my leg. They sonogrammed from my pelvic area, like bikini line area, down on both legs. I felt like they did a pretty extensive job. I was super impressed because the doctor comes in the room and immediately says, well, you are in luck because I specialize in the exact thing that you have going on, and I can help you. I had what's called May Thurner Syndrome, Thurner, May Thurner Syndrome. Don't ask me how it got the name. I have no idea, but basically it is a compression of the left common iliac vein by your right common iliac artery in your pelvic canal. So in your pelvic canal, you've got, these two V things that they V off, they come down off of your heart, they go down, and then they kind of split in your pelvic cavity to go down both of each of your legs. Well, it's very common, especially in women. I was given the number of at least like 20% of women or something have this. And again, so many common things. And I'm like, why do not very many people know about this? But is very common in women between the ages of, I want to say it's 25 to 30 or 20 to 35. Actually, I think it's more like 20 to 40. Women ages 20 to 40 have this problem where that vein gets basically compressed down. And when that happens, it's supposed to be more the high, you're at a higher risk the more babies that you have had. And so I've had 2 babies myself, but that was one of the main questions that he talked to me about, was how my pregnancies were. That it can cause damage. They think that people can be born with this condition, and then it can worsen with pregnancies. And so basically what they did, it was a really easy procedure. I got put under anesthesia, and I was maybe only under for 20 or 30 minutes at most. And then they tested the blood flow, kind of to and from, like away from my heart, going down my leg and then back to my heart. And I was only getting 25% blood flow to my leg. And then all of the valves that work to push the blood back up to your heart were so damaged from these busted veins in my leg. And also I used to be, a lot more overweight. And so he said, if you've had, a weight, you used to be overweight and then you've lost weight, people start seeing kind of those things then, or just being overweight in general can cause the veins in your leg to have busted valves. And then your leg, if your leg's not getting very much flow, then also like your leg is in pain all the time. I would say my leg, it wasn't a noticeable difference. Most people with May Thurner have a larger left leg than their right leg. Most frequently it's your left leg than your right leg. And for me, they say that the symptoms can be like kind of fatigue, like if it takes you a minute for when you go to stand up from sitting down, if it kind of takes a while for that blood to flow back up to your head, that can also be an indication. Painful legs, lots of varicose veins in your left leg. And then also my symptoms were more so in my bikini area. So whenever I was going to get an exam by my OBGYN, or I was getting waxed or what have you, sugared, it was just very, very sensitive and painful, to the point that when they were doing the sonogram, I was like jumping and like jolting away from the gal that was doing my sonogram, because it was just so painful and so tender and just achy and just an overall discomfort. And so this is something that's super common, apparently. I had no idea, but it was also a really easy fix. They put me under anesthesia. They tested my blood flow. I only had 25% blood going to 25% blood flow going to my leg. So they were able to place a balloon stent through my groin area. They were able to place a stent into my iliac vein to hold that open. I did have to be on like a blood thinner for a few months. And then I was on a baby aspirin, and now I'm just on a supplement that just naturally makes my blood thinner. So that's super cool. But it's, something to look at. And again, like I was told even by the emergency room, by my doctors, it's just cosmetic. If you don't like the looks of it, you could go get it lasered. But I wasn't really prioritizing it, because I'm like, if it's cosmetic, then I'm not really in a situation, financially to do anything about that. And it turns out it was not cosmetic. It was definitely affecting the veins in my legs, the blood flow back to my heart, and was something to look at. So if any of these are you, if you're having pain in your left leg, if your groin is always sensitive, if your veins are bulging out and hurting, you know your body better than anybody else. And my suggestion would be to find a vein specialist near you that has really good reviews. Talk to them, tell them your concern about possibly having May Thurner, because again, they call it practicing medicine for a reason. So just because you go to a specialist doesn't necessarily mean that they're going to diagnose you right. And so if you're concerned about that, definitely talk to your doctor about it. But tell them that this might be your concern, because it was a super easy fix for me. I was already at my max out of pocket deductible for the year, so it literally cost me nothing. I went under anesthesia, they placed the stent, and probably took a few months to fully heal my veins from all of that. I also had some other leg procedures because my leg veins were so busted up that I was able to do an ablation, and then I got this other cool like foam thing in my leg. Anyway, all of the things that they did were extremely helpful, and gosh, I wish that someone would have told me about May Thurner syndrome well before then, because I've had bulging veins in my legs for years. So if this is you, definitely talk to your doctor or get a referral for a vein specialist and talk to them about May Thurner. You know, some people have noticeable difference, like their left leg is obviously much larger than their right leg, or maybe you're like me and it doesn't really look that noticeable, but when they measured it, it was definitely noticeable. So I hope that finds you well. I hope it was helpful. Thank you very much for listening. If you could please, please, please do me a favor and hit the like button on this video. And if you could make your way to my channel, you could subscribe. That would be great. But definitely like this video. It would greatly help me out with getting views and growing my channel so that more people can be aware of these things. So thank you very much and stay well.